So I'm delighted to welcome Alanna Kit. She's a neuroscientist, a researcher in the field of psychedelics. A very interesting debate that we had earlier. You've been on the panel, but you're also a co-founder of the art community in Canary Wharf, and you do a lot of breath work, yoga, and a meditation facilitator. Now, we listened to everything you were talking about earlier, and it is fascinating. There's so much evidence and proof, really, how psychedelics can help. I'm going to let you, in your words, explain to us how it's out there now for therapy.
Yeah, I mean, it's a very multifaceted therapeutic. It's being used for depression, anxiety, PTSD, OCD, food addiction, trauma, but it's also great for somatic therapy as well, which is where a lot of trauma lives in the body. And I think we're starting to not only look at it from a central nervous perspective, but also a peripheral. So my research is going into a lot of like chronic stress and inflammation and preventative of diseases before the symptoms manifest, right? So before we have these neuropsychiatric symptoms, how can we actually use it as a preventative approach to increasing neuroplasticity, decreasing perceived stress, regulating our hormones, optimizing our gut-brain axis function, right? So we can start looking at it from a genetic perspective, mitochondrial biogenesis approach, cellularly, but also more on the clinical side of reported symptoms. So we're going at it from multiple different angles.
Which is great. I mean, it was quite interesting earlier. Someone that was in, I think she was a doctor actually, asked you what psychedelics are we talking about, and I mean, you said MDMA,
psilocybin, 5-MeO-DMT, LSD.
And then I think Dr. Nimi, he asked if anyone's actually done or dabbled in the psychedelics.
Right.
I mean, I've done ayahuasca actually.
Amazing.
Yeah, I did it, and you know what? It really opened my mind. I remember coming back, and I went and did fitness DVDs. It kind of, when you kind of hear these stories about, it opens the third eye and it does everything. But I had that experience. I mean, I've never done anything since. But is there anything that you'd recommend to, for what reason?
Like I said before, I think it really depends on how you want to approach the space. You can look at it from a pharmaceutical perspective, you can look at it from an alternative health perspective, spiritual perspective. The most important thing is to be able to support yourself from a pre and post psychedelic journey as well. There's no point in taking a psychedelic if you don't have the proper procedures in place.
And I think the right setting as well.
Set and setting. Yeah. So it's all of it, right? It's the full patient journey of preparing that patient for that profound mystical experience.
So I guess what we're trying to say, or what she's trying to say, is don't just go and buy some illegal drugs and
find a good practitioner. Have those proper integration tools and strategies in place afterwards. But it changes people's lives. It is so profound on such a deep cellular level to look at the world differently. And it's been beautiful to see, many people anecdotally having a psychedelic journey and it changing their lives, and also them being a better person, making better decisions.
We was quite surprised today because I think, again, they asked, Dr. Nimi, he asked actually to the audience who's done it, and he expected no hands. And I think
that's a good amount.
I think there was like pretty much everyone apart from 5. So we've got a lot of secret squirrels out there.
Yes, I think it's good.
It's more popular than you think. That's the thing.
Yeah, and I think people are looking at healthcare differently now. They're like I said before, it's self-empowerment theory.
Yeah.
You were becoming your own healer. You were taking that responsibility to look after your full spectrum of wellness and health.
Well, we look at it, there's a lot of women that are going through menopause symptoms that are microdosing with the mushrooms and things like that. I mean, I've done it, and it's definitely helped. There's obviously like capsules out there that, that help during the menopause, so it's getting a lot more popular, So carry on doing what you're doing. I'm sure they're going to have to legalise it all at some point.
And if not, we'll still do it.
Yeah, exactly. Chris! Thank you.
Love it. Thank you.